We all know that diet and exercise are good for our health, but so is sleep. How much sleep you get can really determine how things are throughout the day for you. Dr. Pallavi Reddy, a sleep medicine specialist with Cone Health LeBauer Pulmonary Care at Burlington, is talking to us about getting a good night's sleep. So let's talk about this, how to prepare for the upcoming time change, because it's coming next weekend.
Thank you for having me. This is such an important topic because sleep really impacts every aspect of our health.
Absolutely. All right, so how could not getting enough sleep really impact our health, and how much should we be getting?
So, sleep is essential for both physical and mental health. When we don't get enough sleep, it affects our mood, our memory, our immune system, and heart health. So, long term sleep deprivation has been linked to conditions like high blood pressure, diabetes, depression, and weight gain. Most adults need about 7 to 8 hours of sleep per night to function at their best. So, sleep is not downtime, it's when the body repairs and resets.
Yeah, we need that every single night. All right, so what are some common mistakes maybe that people make that prevent them from getting a good night's sleep, and what should we do instead?
Well, one of the biggest mistakes is having an inconsistent sleep schedule. Our brain thrives on routine. Other common issues include using screens before bed, drinking caffeine too late in the day, alcohol close to bedtime, and trying to catch up on the weekends. And consistency is really the key.
All right, so let's talk about like what a healthy sleep routine looks like for an adult.
Well, ideally, you want to go to bed and wake up at the same time every day. So, having a wind down routine, something relaxing like reading, listening to soft music, or taking a warm bath. Also, make sure your room is cool, dark, and quiet. Those small changes can make a big difference.
Yeah, I like you said, cool, dark, and quiet. And I think to myself, that's why I'm always telling my husband, hey, you need to shut the blinds. I can't even see like a little bit of the light. I need it all dark. What about kids? Because I'm imagining the same kind of routine would be good for them, but are there some additional do's and don'ts when it comes to kids?
Well, sleep is critical for children's brain development and learning. So make sure they have a consistent bedtime routine, no screens at least an hour before bed, and keep devices out of the bedroom overnight. Kids who sleep well perform better academically and emotionally. I know my kids are watching this and they hear this from me all the time.
They may not want to listen, but they hear it from you all the time. Okay, so daylight saving time begins this weekend. We're going to be setting our clocks ahead 1 hour, springing forward. That means we're losing an hour of sleep. What kind of steps should we be taking now?
Great question. So start by adjusting your schedule a few days early by going to bed about 15 minutes earlier each night. And also, morning sunlight is key. It helps reset your body clock. Most importantly, avoid caffeine late in the day.
And I'm guessing that's what we should be doing with our kids as well. We should be trying to get them to go to sleep a few minutes beforehand.
Exactly. So 15 minutes earlier each night before, usually a week before the time change.
And 15 minutes, I mean, that doesn't seem like too much. It's so much better than trying to do like an hour or something like that the night before. That's not going to really help us get into a better sleep schedule.
Well, baby steps. I mean, somebody who's going to bed an hour later than they should be, 15 minutes is not much.
So what happens when we just cannot fall asleep? What do we do? Do we get out of the bed? Do we read a book? What do we do?
Well, if you're lying awake for more than 20 minutes or so, get out of bed and do something relaxing in dim light. Usually after 6 p.m., we say dim the lights in your house. Avoid staying in bed frustrated because we don't want to associate your bed with the anxiety of not sleeping. And then return to bed when you feel sleepy.
Okay, so tossing and turning and looking at the hour every like 15 to 20 minutes, not good. Actually get up out of the bed. What about some sleep medications? Lots of people use a sleep aid, whether those are an over-the-counter sleep aid or one that they consider natural, like melatonin.
Well, melatonin can be helpful for certain situations, especially with circadian rhythm issues like jet lag or time change, but it's not a traditional sleeping pill. Lower doses are usually sufficient, like between 1 and 5 milligrams, I would say.
Okay. And so if we're going to take something over the counter, is there something that we should be aware of there?
We don't generally recommend taking Benadryl or, Tylenol PM, which contains Benadryl, long term, because it can be linked to memory concern long term.
Okay, so many people are on GLP-1s right now. Do they help with sleep? Do they impair sleep? How does that impact?
Well, what's exciting is that Zepbound, also known as tirzepatide, is now approved to treat obstructive sleep apnea in adults with obesity. It's the first medication approved specifically for this condition, and it helps by working on weight loss and reducing the severity of sleep apnea. And it's important to understand that patients still need a proper diagnosis and evaluation by a sleep specialist. And CPAP therapy remains gold standard for treatment of sleep apnea in most patients.
Okay, maybe we're not all the way there yet. Are there some alternative strategies without medication to help us go to sleep?
Cognitive behavioral therapy, just working on your sleep routine, your consistent wind down, where you're flipping through a magazine, reading something, taking a warm bath.
Okay. At what point should someone consider seeing a sleep specialist or having a sleep study? And I guess you can't just jump into that. You probably should start with your primary.
Yes, well, if someone has loud snoring, excessive daytime sleepiness, pauses in their breathing, or chronic insomnia, they should absolutely be evaluated. Sleep disorders are very treatable, and getting help can truly be life-changing.
Okay, gotcha. And then, so talk to your primary care doctor, though, first. I mean, I think a lot of times we go and we think about our cholesterol and that kind of stuff. We just don't even bother saying, hey, I'm not sleeping good.
Absolutely. I urge everyone to discuss their sleep concerns with their primary care doctor, so you can get evaluated and treated adequately.
All right, what about people who work like all kinds of weird shifts or a night shift? Any advice for maintaining a consistent and healthy sleep pattern for those folks?
Of course, they should protect their sleep by keeping a consistent schedule, using blackout curtains, and creating a dark, quiet sleep environment. Sleep should be treated as a priority.
Self-care for sure. All right, so how does anxiety figure into sleep?
Well, when you're having ruminating thoughts at night and you're laying in bed and anxious about other things going on in your life, you start associating your bed with just anxiety. And your brain is confused. Is it laying in bed just being anxious, or is it linked to, your quiet, calm environment where you're supposed to go to sleep? So if you are suffering from anxiety, I definitely urge you to speak with your primary care doctor and treat that underlying problem.
Okay, we've got about a minute or so left. Maybe what's the biggest myth about sleep that people still believe but they should not?
Sleep is for the weak. So sleep should be treated as a priority, like I said earlier. And in the olden days, people thought that when you work, there's no time for sleep. But that is beyond false. You are doing damage to your health by prioritizing work or just watching your favorite show at night. So really prioritizing that 7 to 8 hours of sleep is doing wonders for your health.
Okay, well, thank you so much for your time and your expertise, and that recommendation that we should all be going to bed about 15 minutes earlier every single night this week because of daylight saving time, which is this weekend.